So we see a lot of patients with headaches, and there are many causes of that. Oftentimes what we find is the most frequent is that it's from their neck creating head pain, so which most people call headaches. So you can have pain referring into the head from muscles of the neck or from the joints in the neck, and sometimes from the muscles in the head, or even sometimes blood pressure changes inside the brain and so forth. So there's many causes, but the majority of what we see is a cervicogenic headache where that's referred pain from the neck into the head. And it's usually on one side, and there's a mix of areas that can refer up. We have, the sternocleidomastoid here, suboccipitals. There's a greater occipital nerve here that can get entrapped. So as the nerve goes through what's called a piece of fascia, that can get entrapped and snagged basically, and then that causes pain up into the neck. But oftentimes it'll come up over the head and all the way down, sometimes around the eye, or on the forehead, on the side of the head. It's just a mix of different possibilities. But normally there is a neck motion that can trigger that or recreate it. So sometimes it's sitting in front of a computer where you're squinting if it's a vision problem that's creating that. But one of the most common things we see is while sitting, so you're kind of flexed like this, and if I just flex my spine where I bend like this because I'm sitting in bad posture, well, my head points down. So what I have to do is now lift my head to look at the screen, and what that does is that shortens the muscles of the back of the neck. And that shortening, imagine just a muscle contraction all day, or at least for 8 hours, and that creates a significant amount of tension, and that can add up over time and then create headaches. When we're assessing you for headaches, we have to rule out a bunch of things first. So any fever, severe headaches, neck stiffness, vision changes, things like that suggest other problems. So once those are ruled out, then we go through our standard musculoskeletal assessment for neck and headache, which is range of motion. So we look to see what's tight, what's weak, and do any of the muscles we stretch, do those refer to the head? So part of the exam is a palpation exam where we push on the muscles, and we're looking for the exact reproduction of your pain, so referred pain into the head that matches the same pattern you've been describing. The other thing we can do is assess ligamentous laxity. So basically we mobilize, which stresses the joints in very specific ways, and that can show us, is that a joint issue or a muscle problem referring pain into the head? So that combined with a neurological exam to make sure there's nothing else involved is the best workup for your neck pain. Once we have a really thorough evaluation and a clear diagnosis, we can develop a treatment plan for you. In the office, what we'll do is we'll focus on adjusting and soft tissue work. Those typically do quite a bit to reduce your pain fairly quickly, especially once we can reproduce and press on the same area that is creating your head pain, your referred pain. So we will use a combination of active release technique, although we have to be somewhat careful with our soft tissue techniques because we can irritate specific nerves or sometimes be too aggressive. And so we're pretty gentle when it comes to cervicogenic headache when it comes to soft tissue work. So we will use active release technique, trigger point technique, as well as deep tissue massage to just relax all the muscles and decrease the overall tension. We will also use adjusting to free up some of that motion. Any restricted joints in your neck, we can adjust those and relax any tension through there. So mostly we'll be focusing on that in office, and then we'll be focusing on out of the office things for you to do to significantly help yourself in between visits. So some of that is stress relief. So stress levels typically have a cascade of events. So stress during the day creates difficulty sleeping at night, which then makes us more irritable and a little bit more prone to stress and pain and tension. So it's kind of a positive feedback loop. So we want to make sure that you're sleeping well and trying to reduce the stress levels in your life, because that makes a significant difference for most people. Sometimes it's exercise and a few other things to help calm that down. Some of the other things is we'll be having you do some strengthening. So often the deep neck flexors, so not the SCM, but underneath that on the front of your spine are some small muscles that help to support the spine. So we'll be focusing on strengthening those, as well as some regular stretches to loosen up anything that's tight. Anything that you can do on your own to help would be the best. If you'd like help feeling better from your headaches, please give us a call. We'd love to help.